When should I consult a doctor about my discharge before my period?
Friendly greeting. Hello everyone, and welcome to today's video. In this video, we'll be discussing an important question that many women may have. When should I consult a doctor about my discharge before my period? Introduction to the topic.
Understanding normal vaginal discharge.
Vaginal discharge is a normal and healthy occurrence for most women. It helps to keep the vagina clean and lubricated, protecting it from infections. The amount, color, and consistency of vaginal discharge can vary throughout the menstrual cycle. Generally, the discharge tends to increase in the days leading up to ovulation and may become thicker and stickier.
Identifying abnormal discharge.
While vaginal discharge is usually normal, certain changes in its characteristics may indicate an underlying issue. Highlight. If you notice any of the following changes in your discharge, it's important to pay attention and consider consulting a doctor. 1. Unusual color. If your discharge is green, yellow, grayish, or has a strong, unpleasant odor, it may indicate an infection. Highlight. These changes could be a sign of bacterial vaginosis, a sexually transmitted infection, STI, like trichomoniasis or gonorrhea, or even a yeast infection. 2. Itching, burning, or irritation. Highlight. If you experience persistent itching, burning, or general irritation in the vaginal area, accompanied by changes in your discharge, it could be a sign of an infection or an allergic reaction. Highlight. Some common causes include yeast infections, bacterial vaginosis, or an allergic reaction to certain products. 3. Abnormal consistency or texture. Highlight. If your discharge becomes unusually thick, clumpy, resembling cottage cheese, or frothy, it may indicate a vaginal infection. Additionally, if the discharge has a frothy or foamy appearance, it could be a sign of trichomoniasis, a common STI. 4. Excessive amounts. While increased discharge is normal during certain times of the menstrual cycle. Highlight. If you notice a sudden and significant increase in the amount of discharge, it's worth discussing with your doctor. It could be a sign of an infection or hormonal imbalance.
When to consult a doctor.
Highlight. It's important to remember that every woman's body is unique, and what is normal for one person may be different for another. However, there are certain situations where it is advisable to consult a doctor about your discharge before your period. 1. Persistence and worsening of symptoms. Highlight. If you experience persistent changes in your discharge, such as unusual color, consistency, or odor, and the symptoms do not improve or worsen over time, it is essential to seek medical advice. Highlight. These changes may indicate an infection or other underlying conditions that require treatment. 2. Unprotected sexual activity. Highlight. If you have had unprotected sexual activity or suspect you may have contracted an STI, and you notice any abnormal changes in your discharge, it is crucial to consult a doctor. Prompt medical attention can help diagnose and treat any potential infections. 3. Discomfort or pain. Highlight. If your discharge is accompanied by discomfort, pain during intercourse, or any other unusual symptoms, it's best to consult a healthcare professional. Highlight. Such symptoms may indicate an infection, inflammation, or other gynecological issues that require evaluation and treatment. In summary, while vaginal discharge is